Hey everybody, it's Jax James. I'm the State Policy Manager for NORML. Welcome to the stream for today. We have a guest with us today, and his name is Morgan Fox. He has become our new Political Director starting this year, and he's going to be giving us some federal updates. Also today, I'll be going over some moving legislation. You'll see in the description of this live stream, of course, a link to the blog where you can take action on any of those. You'll also see our ACT pages there. So when Morgan starts giving you updates, that's also where you'll find some federal actions you can participate in. So I want to go ahead and introduce Morgan. Morgan Fox started with us in January, right, Morgan? And you are taking over for Justin Streckel, who was serving as political director for 5 years previous. So I want to pass it over to you to introduce yourself to the NORML nation, if you will, and tell us a little bit about what's going on federally.
Yeah, thank you very much, Jax. So my name is Morgan Fox. A little bit of background about me. I've been involved in cannabis policy reform professionally since 2008. Moved down to DC from Cleveland, Ohio, where Justin is also from, in '08, and basically moved down for an internship at MPP, the Marijuana Policy Project, and worked my way up there over the course of about a decade to communications director, at which point I moved over to the National Cannabis Industry Association as their media relations director, where I was also heavily involved in policy work. And then now I have started with NORML as the political director, taking over for Justin and trying my best to fill the very big shoes that he left me to help us get across the finish line in terms of descheduling and pass other legislation that is going to be beneficial for cannabis consumers. So I'm very happy to be here. Very excited for the work that we're going to be doing together, both at the federal and state level, and looking forward to working with all of you. In terms of federal action right now, I'm sure you've all seen that Congress is very heavily involved in non-cannabis things right now, as is the administration. But we're trying to keep up the drumbeat and maintain momentum going into the rest of the session, as well as into the next session in 2023 in Congress. And I'm sure that most of you already saw that we're starting to ramp up our pressure for the Biden administration to keep its campaign promises to expunge federal cannabis arrests and convictions, as well as to do some of the other things that the administration could very easily do with the stroke of a pen, such as directing the Department of Justice to officially reinstate the Cole memo, and hopefully the Department of the Interior to do something similar so that we can get protection for indigenous groups and tribal authorities to be able to do the same without the threat of interference from the Bureau of Indian Affairs or Department of Interior, not to mention the Department of Justice. At the moment, our primary focuses are on getting more co-sponsors for the MORE Act. This originally passed in December of 2020 with broad bipartisan support. It was the first time that a legalization and descheduling bill had ever been approved by either chamber of Congress. And because we're in a new Congress again, we have to do this again. The bill has changed slightly, but almost entirely in positive ways. And we're trying to get as many co-sponsors as we can so that we can go into a potential floor vote in late February or early March to get this passed through the House of Representatives again. A big reason for this is that we need to just keep this conversation at front of mind in Congress. Even if it's not necessarily going to be able to get through the Senate this year, or any other really comprehensive bill getting through the Senate, because we simply don't have the 60 votes necessary to make that happen. It's very important that we get as many of these bills passed through either chamber as possible, so that we can keep this conversation going and be in a better position next year. So I encourage all of you to reach out to your elected representatives and ask them to co-sponsor the MORE Act if they have not done so already, but at the very least to commit to voting yes on it when it comes to the floor in February or March. We're also working on making sure that the appropriations bills for the federal budget will include the existing protections for cannabis programs and hopefully expand upon them in terms of things like allowing federal agencies to rework their employment policies so that people who are federal employees that live in states where cannabis is legal will not have to worry about a positive test for cannabis consumption affecting their employment. Also, working to make sure that the rider that has prevented the DC government from being able to regulate cannabis, despite the fact that voters in my city voted to make cannabis legal in 2014, but have not been able to regulate it yet. We're hopeful that we can also get the protections that have existed since 2014 that protect state compliant medical cannabis patients and providers from federal interference to be extended to adult use programs. That is slightly less likely to happen during the current budget negotiations, largely because we expect that the budget that has currently been continued from last year to be continued again when it expires in February. But we want to make sure that that conversation stays alive so that we can get it into the next budget and get it approved. Aside from that, we're definitely working on plans to make sure that at the very least we can get some incremental changes passed in Congress this year, whether that be the Safe Banking Act, the HOPE Act, or any of the other number of bills that are out there that would remove barriers to research or increase veteran access to get through Congress this year and be signed by the Biden administration. It's absolutely vital that we pass something regarding cannabis this year. Otherwise, we're going to lose a lot of momentum, and the very real possibility that the makeup of Congress is going to change significantly in November will create a lot of both opportunities, but also a lot of roadblocks to getting more comprehensive reform passed. So we really need to keep up the drumbeat. So please continue to contact your federal lawmakers. Go to the Take Action page on NORML's website and just keep that drumbeat going. Try to get your elected representatives in Congress to, at the very least, commit to yes votes on everything from incremental to comprehensive reform measures, and if possible, co-sponsor as many of them as possible. And be on the lookout for further communications from NORML about exactly how to go about doing that and what bills to focus on.
I was muted, sorry. Awesome. Thank you so much for that update. I really appreciate you joining us. I told everybody that you were going to be with us last time, and then I had all those technical difficulties, and I really appreciate you coming back this week. I tooted your horn a little bit too and let them know that you got 2 new sponsors signed on to the MORE Act last week. So good job, Morgan. Great way to start your new job at NORML. We're both new.
Yeah, I'm really excited. It's been wonderful so far, and I can't wait to just keep getting my hands dirty and wrangling with these elected officials to actually enact the will of the majority of Americans.
Absolutely. Well, thank you for joining me, Morgan, and hopefully I can have you back in another couple weeks and we can do another update together.
Absolutely. Thanks, Jax.
Awesome. Take care, Morgan. Bye. All right, everybody. Now we're going to switch to the state update. There has been a lot going on. So not every state currently is in a legislative cycle, but quite a number are, and there are bills moving in multiple states. So I'm doing these weekly updates to make sure that you guys are knowing what's going on. And this week is pretty extensive. There is a lot of stuff going on. We know that some filing deadlines will be approaching within the next few weeks. So we do anticipate going through, there's about 400 plus bills that we're tracking and kind of prioritizing which ones we want to really make sure we're putting our efforts behind. So that'll be in the coming weeks. But right now we're still seeing a lot of bills filed. So I want to go over some important things that are happening. Now this week, I will say there's been quite a number of bills that NORML opposes that we're going to be talking about, some legislation that we do not want to see passed. And so please, if you live in those states, make sure that you are also taking those actions. I alternate going from A to Z and Z to A every week so that you guys don't necessarily have to wait till the end if you're Virginia or Texas like I am. So this week we're doing Z to A, and we're going to start with Washington State. So Washington State has 2 bills that are providing tax exemption on medical cannabis products that are purchased by registered patients from a licensed dispensary. As you know, some states do tax this medicine, and we don't believe in the practice of taxing medicine. In fact, you'll see on tax returns that prescriptions and medications are one of the things that are tax deductible. So if you live in Washington, this is an important change to make sure that patients aren't having to pay taxes. So make sure you send a message to your lawmaker there. Also in Washington, Senate Bill 5517 would protect marijuana consumers from employment discrimination by prohibiting employers from refusing to hire individuals solely because they have used marijuana while off the job or test positive for THC in a test. Or in a drug test, excuse me. Now, this bill was heard just this week on the 26th on Wednesday, but no further action has been taken yet. It is still pending in that committee. So please make sure that you send a message to your lawmakers letting them know that you do support this important legislation. Okay, so in Virginia, I'm sure you guys watch JM do their Virginia stream on legislative updates. So they'll be going into these really in depth, and there are quite a number of bills from Virginia. So rather than go by each one line by line what the bill numbers are, I'm going to kind of present them to you in dockets, if you will. So there's quite a few bipartisan bills that have been introduced that would allow the retail sale of cannabis for adults 21 years and older. You know, Virginia voted to legalize back in 2021, and the time is now for these bills to actually move forward so that they can be instituted and available to the people of Virginia. So there's 1, 2, 3, 4, 5, 6, 7 bills having to do with legalization in Virginia. So we've got an action alert for you guys there. Oh, this printed very not right. Uh-oh. Well, hold on real quick. Printed like that. That's interesting. I don't think this is. Okay, so this is also the downside to printing it. See, last time I had used my online document, but then the screen was shaking a little bit, and I didn't really like that. So I printed it out, and I didn't look at it in advance. And apparently, it printed really weird, where only half is on one page. So I'm now moving over to this document. Okay. So we were talking about Virginia and legalization. So next in Virginia is a House Bill 461 that would limit state and local governments and other agencies from sanctioning participation in the medical program. So basically, they were trying to prevent people from having adult use markets in localities through referendum, and this is to prevent that. Additionally, there's legislation that would take all of the statute and change the word marijuana to the word cannabis. So that's another action that's happening in Virginia. Now, here's some legislation that we are opposing in Virginia. There's 3 bills that would change the current law. Now, in Virginia, the cops are prohibited from stopping, searching, or seizing any person, place, or thing based on the odor of cannabis. So now these bills would be reversing that, and therefore that would be a pretty ridiculous change to something that should be allowed, that, you know, it's legal to possess it, so therefore why would we be stopping solely based on the smell? Another bill that NORML is opposing out of Virginia is House Bill 72. It has been introduced to prevent the sale of seeds and immature plants by licensed cannabis cultivators and facilities. So Virginians are allowed and permitted to grow up to 4 plants at their residence, and therefore they should be able to purchase these seeds. So we do oppose that restriction. There is another bill in Virginia, but we're in favor of this one, and it would, I'm sorry, we're opposed to this one, and it would repeal provisions facilitating the expungement and sealing of records. People shouldn't have their whole life derailed because of something that is now legal in Virginia. So why would we repeal expungement, right? So please make sure that you're engaging in Virginia. Like I said, there's quite a few bills moving in Virginia, well over a dozen that are being tracked. And so click on that first link in the description here, and you'll be able to go right to those actions. Now, in Utah, there is a bill to strengthen protections for medical cannabis patients, employment protections, preventing from court discrimination for parents based solely on being a cannabis patient, and it also includes protections for parents and legal guardians of minor patients. And this bill had a hearing on Thursday, the 27th, so just yesterday, and it was passed out of committee with a vote of 9-2. So that's some really important advancement in Utah, but now is still the time to email and let them know because there are more stages ahead for this bill. Now, moving on to Tennessee. So in Tennessee, current law criminalizes possession of adult use of cannabis as a misdemeanor. You can get a year in jail, mandatory fines, and there's about 20,000 Tennesseans that are arrested every year for marijuana possession. So this legislation, which is known as Free All Cannabis for Tennesseans Act, or FACT, would establish an adult use regulated cannabis market. So that would be extremely important in Tennessee. Additionally, there's some legislation to improve medical program there. There's some bills that have to do with quadriplegia and also with veterans. So you can send a message in support of that bill if you're in Tennessee. Now, South Dakota had several measures that NORML is opposing. The first measure is House Bill 1088, and it would place restrictions on the potency of marijuana, limiting the concentration of THC to 15%. Now, we oppose any THC caps because this significantly limits medical patients' access to these stronger forms of medicine. Just as conventional medicines are readily available with a variety of strengths and potencies, so should medical cannabis products. Additionally, there is a bill, excuse me, that would repeal a medical cannabis patient's ability to grow their own medicine. So it would repeal this home cultivation provision. And that did pass the House with a vote of 41-29. So now it's headed over to the Senate, and it's extremely important that you message your lawmakers in opposition to this effort and hold them accountable for undermining the will of the voters in South Dakota who wanted to have home cultivation included in the program. Another South Dakota bill that we are opposing is House Bill 1094, which would place restriction on public school children's use of cannabis medicine on school property. This would reverse the current protections that does allow children to have access to their medicine at school. The bill had a hearing on Thursday, the 27th, and it did pass out of committee 7-5. So if you live in South Dakota, it's extremely important that you take action on those three efforts, which are unfortunately moving, and let your legislators know that you oppose them. Now, there was also a bill that would have been an edible ban. It would have banned edibles and different forms of medical cannabis in South Dakota, and its number was 1058. However, it was defeated in the House by a vote of 21-47. So it's good to see that that bill did not advance, but we do still have THC caps and patient protections that are in jeopardy, as well as home cultivation. So make sure in South Dakota that you're participating in this action alert. All right, another southern state, South Carolina. So the South Carolina Compassionate Care Act would allow qualifying patients to use, purchase, and possess medical cannabis with a recommendation. Opponents of medical cannabis access say that they will do anything they can to block the bill from receiving the consideration it deserves. But the Senate sponsor Tom Davis is really prepared to fight back. SB 150 was debated this week on the Senate floor, and further debate is expected on Tuesday, February the 1st. So stay tuned next week for another update from South Carolina to see how their medical expansion bill is advancing. For those of you in Pennsylvania, there is legislation filed, SB 1024, that would allow for medical cannabis patients in Pennsylvania to grow and cultivate up to 6 plants at a time in their residence. Currently, medical patients can't grow, so this would be extremely important for helping mitigate the financial burden of purchasing from a dispensary without being able to utilize your health care insurance. All right, Ohio. Legislation in Ohio is Senate Bill 261, and it would expand medical cannabis access to the patients there. If passed, it would expand the conditions to include any condition for which a patient could benefit or experience relief in the opinion of a physician. And we like to call these let doctor decide type legislation, which of course is a very good common sense policy. And there's an update here for you guys. After passing the Ohio State Senate with a vote of 26-5, SB 261 is now headed for discussion in the House. So hopefully we'll see some more movement in Ohio soon, but make sure that you click and send a message to your legislators in support of this effort so that they know that you want them to vote yes when it comes to the House. Now moving to Kansas. So Kansas has filed a House Concurrent Resolution 5025, and it would amend the state constitution to legalize the recreational use of marijuana beginning in July of 2023. So if passed, the bill would be placed on a ballot with a question regarding recreational cannabis, allowing Kansas voters to decide whether or not to legalize. Then it would come back to the House to have all of the statutes and regulations put into effect. Currently, possession is still a criminal misdemeanor in Kansas, so this would be a great advancement forward. Make sure that you reach out to your legislators if you live in Kansas. Now, Illinois. House Bill 4799 would allow home cultivation. So it would allow a person to cultivate cannabis plants with a limit of 5 plants over 5 inches tall. I don't know why we care how tall it is, but that's the way that they wrote it. And it would allow those individuals to purchase safe tested cannabis seeds from a licensed dispensary as well. Now, there is a bill in Illinois that NORML is opposing. It's legislation 4709, and this would impose restrictions on the potency, basically putting a THC cap of 10% on cannabis flower. Now, I talked earlier about the reasons that we oppose a cap, and so we oppose them for the same reasons here in Illinois. Now, in Hawaii, there are actually quite a few bills on the move. Multiple bills are pending that have to do with legalization, cultivation for adults. And there's some newly filed bills that you'll find there as well. So make sure that you click. I want to say that there's like 10 bills maybe in Hawaii that have to do with legalization. So if you live there, please make sure that you participate. There's also multiple bills that would expand access to medical cannabis. It would allow for testing, caregivers, making qualifying patients anyone over 65 years and older. So there's quite a few different bills there that have already been filed and were newly filed. So make sure that you click and take action there. Then there's a great update out of Delaware. So I've been talking about HB 305 in Delaware. It's the revised adult use legislation, and it has advanced out of the House Health and Human Development Committee with a vote of 10-4. And so now it's going to be moving to the next step. And if you are in Delaware, please make sure that you click and send a message to your legislators in support of this effort. So I'm going to come over to the comments over here real quick. We had Morgan earlier giving an update on federal actions. So you can go to norml.org/act, and at the top of the page there is all of our federal actions. And then you can hover over your state, and it'll pop up every single action for the state that you live in if you're in a legislative cycle. Now, as I said, not everybody is. For example, I'm in Texas. It is not currently our legislative cycle. We're in the interim, and that's where we do more regulatory advocacy, relationship building, and planning for the legislative cycle. But a lot of people have legislation that is being filed and moving. You know, all of the state legislators act differently. There's also some ballot initiatives and referendums, and I posted a blog about that about 2 weeks ago, and I plan to do another one in the coming weeks to give y'all an update. So let me look over here. Hello, my friends from Texas. Hello. All right, let's see. Talking about Nancy Mace's federal bill. Yes, that is a great bill, and I believe there is an action on the page if you would like to participate in that. Oh, hi, Sharon. How are you? Just trying to make sure I don't miss any questions. I love all of y'all's comments about where you're from. I really appreciate it. Oh, Sharon wants to know the bill number in Tennessee. Let me go back over here. So the bill for legalization is House Bill 1968. And then there's 4 different bills that have to do with medical, and you can click on the action there and you'll find all those, Sharon. Someone talking about Florida. Yes, okay, let's talk about Florida. If you're in Florida, you got an email from me yesterday. Governor DeSantis said that he doesn't think we should legalize because of the putrid odor of cannabis. Cool. So I'm sorry, that's why we're not going to legalize it? I don't think So we put together an action about that so that we can let the governor know that the people of Florida, by polling, have approved of the idea of legalization of the adult use of cannabis. And for him to say that he's not for it because of the smell is ridiculous, because we know that consumption locations, much like bars, could fix that. So someone was asking about Maryland. I haven't seen Maryland's ballot initiative move yet. I have not gotten any notifications on that, but there is an action on it. So I definitely encourage you to still participate. Even if your bills are not moving right now, if you're in a state that has legislation moving, make sure that you're clicking on your state and participating in those to create the pressure and the support that these legislators need to advance. All right. Well, I don't see any more questions on here, guys, but I really appreciate everybody tuning in today. I appreciate Morgan for joining me and giving us an update. We're two longtime cannabis activists, but newbies at NORML, and so it was great to share some time with him today. So I'm going to bid y'all adieu. Please make sure that you, in the description, click on my blog from today so that you can look at all the different actions. Make sure that you become a member for NORML. You can support our mission and our advocacy by membership dues or by making a direct donation if you'd like. We also have some really great swag and merchandise that you can purchase on our store, so you'll find all those links there. If you're curious about the chapter near you, please make sure and click on the chapters link and get connected with your local chapter. And on that note, I'll bid y'all adieu. Have a great Friday and a wonderful weekend.